We're getting a better idea of who is in line next to get the coronavirus vaccine here in Kentucky. Governor Beshear today updated the state's distribution plan. As of today, more than 11,000 doses have been administered. That's about 3/4% of the adult population. And Kentucky has more than 65,000 doses of the vaccine on hand. Another 60,000 are expected this week. Those doses are targeted for frontline healthcare workers and long-term care facilities. First on Fox, Shelby Smithson explains who's next once those groups are complete.
2 different vaccines, 4 shipments, more than 168,000 doses, all delivered to hospitals, health departments, and long-term care facilities across the Commonwealth. But it's still just a fraction of what Kentucky needs.
Right now, the vaccine is trickling in, but it's not enough. But as production ramps up, as more vaccines come online, we're going to have a lot more coming in.
A 5th shipment of more than 34,000 doses is already on its way, meaning 40 additional sites will get the vaccine for the first time this week. These allocations are still meant for frontline healthcare workers and long-term care facilities. Though we may still be more than a month out, the state did outline the groups that will come next.
We've got some key priorities that I believe are shared all around the state, and we have an emphasis on preventing deaths and making sure we can deploy the vaccine as quickly as possible to the group that suffers the most, the worst outcomes from this virus, which are our seniors.
With that in mind, Phase 1B will include people 70 and older, first responders, and K-12 school personnel. The one thing that is asked in every phase is patience.
I need to beg your patience. We are doing the equivalent of a World War II mobilization here, trying to bring up to speed this incredibly complex undertaking. It's going to take a few weeks, both to get the systems in place and also to get enough vaccine to reach everyone.
At the state capitol, Shelby Smithson for the Fox 56 10 o'clock news.
Health leaders say it will likely take through January and possibly into February before Phase 1A of the distribution plan is complete.